Hi, I'm Dr. David Novatnak of Doctors Choice Physical Medicine Rehab in Pottsville, Pennsylvania. And today we're going to review a special test that we do at our clinic. And what it is a measurement of muscle activity, electrical muscle activity when you move. So just how you get an EKG of your heart, they put little sensors around your heart and record electrical findings. This is like an EKG, in this case, of a back. We put sensors on your back and have you move. So this is part of the test. This was just of left rotation. So the patient was seated in the chair and rotating towards the left. And what's interesting about this is my case. I hurt myself, I believe it was early November. And this first test is November 25th. So this is about 2 weeks after I hurt myself. I decided to do these tests and document my progress as I recover from the injury. The second test is December 3rd, and the third test is January 10th. So we got a range of about 6 weeks here between these tests. Now, to look at this test, there's two colors on here. One's blue. Blue would be the muscle activity from my left side, and the red is the muscle activity from my right side as I rotated towards my left and came back to center. And I repeated it 3 different times. So the same movement was done on all 3 tests. Now, when we look at this first test, if you could zoom in on that, we're going to see a lot of up and down, a jitter in the recordings. So what that is muscle spasm, or we call it fasciculation. You have no control over that. Those are your muscles reacting to pain or the abnormal movements or your injury in your body. So those are all non-voluntary movements. And you can see I had muscle spasm on both sides. So as I turn towards my left, we would expect to see a peak here, particularly on the left side. So you do see a little bit of a peak. I came back to center. I peaked up again as I turned left, came back, and the third time, when I turned left, I peaked a lot higher. This is more of a normal test, what we would expect to see. But what I was experiencing was a co-contraction. If you look at the high point here of the red and the high point of the blue, there's very little change in the amount of muscle activity between those two. So as I was turning left, the muscles on my right side were saying, no, don't go that way. They were trying to pull me back. By the time I got to the third test, we were starting to see some pretty good separation there. So even though I was still having muscle spasm, my back started to work a little bit better with that movement. So now we're going to move on to the second test of December 3rd. So this is about a week later. And you can see there is definitely less muscle spasm than the first test. There's less jitter. We're just seeing some jitter maybe at the end points of the neutral points of the test. And what we're seeing here now is a little bit more separation than we did before between the tests. Okay, so there was less co-contraction going on, and as I did this, we got more of a separation between the muscle activity between my left side and my right side. So there was less spasm, less co-contraction. I was definitely doing better here than it was back a week earlier. The third test is interesting. I was feeling much better now. This was January 10th, and I'm still twisting towards the left, and this is the difference in the co-contraction now, okay? So there's very little co-contraction going on at this point over here. There's good separation between the muscles on my left and the muscles on my right. And what's happening here is when I'm twisting left, my left muscles, the blue, should be going higher than my right, and they're finally starting to do that. Although I'm still getting some activity coming up on the right side. So although I'm feeling pretty good right now, I'm still experiencing some abnormal muscle function in that test. And this test is very good for cases that involve any like auto accidents or work comp cases, because we can objectify what's going on in your muscles. Okay? So sometimes these tests don't, what's wrong doesn't show up on an MRI, or if it does show up on an MRI, we can actually measure to see how your body's responding to those abnormalities that show up on the MRI. So if this is something that interests you or think we can that we can help you out with your back pain or your neck pain, or you need documentation for your workers' compensation case or an auto accident case, you could share this with your attorney. Not many attorneys know about this type of testing. I'd be happy to talk with them. But if you're interested, you can give us a call at Doctor's Choice Physical Medicine Rehab in Pottsville, Pennsylvania.